Hi, welcome to Vaughn Gillette's YouTube channel. Are you prone to low back pain? Well, if you have anterior pelvic tilt and you get low back pain from time to time, check out these assessments and exercises to help you get out of anterior pelvic tilt and prevent that low back pain from flaring up again. To really find out if you have tightness in the low back, we're going to use the prone rock test, which has us kneeling down, bringing our butt to our heels, and having our arms be overhead. We're looking for a uniform spinal curve like I'm demonstrating here with no flat spots in that low back area. This test can also be used as a great stretch as well. Our whole spinal curve should look just like a turtle shell. If you have a flat spot like Ariel does in that low back area here, that means you have a tight low back, which you need to address. Ariel has a hinge point in his thoracic spine there, and if he did have that hinge point in his low back area, we would need to make sure that whenever we stretch it, the stretch forms a nice smooth curve without any hinge points, just like a turtle shell. Now, for those of you who are hypermobile, you need to make sure that you don't overdo it, you're not stretching to the point of pain, which goes for anyone as well, and we're not stretching upon the first 30 minutes upon waking up in the morning. If you are hypermobile, you still may need to stretch to help you get out of anterior pelvic tilt and to help deactivate those low back muscles. I just wouldn't do it this much. Now, in Ariel's case, he had ACL reconstruction surgery, so in the prone rock test, which was the first picture that you saw earlier, his knees hurt in that position. So we can unload those knees, putting him in a seated position, bringing his knees to his chest, making sure that he still feels the stretch in his low back. But what I have him do also in the stretch is help him extend his thoracic spine to help eliminate that hinge point in the middle of his back. In this next picture, we're doing an assisted stretch, again, making sure that he feels that stretch in that low back position. I'm pushing down pretty hard because there's a lot of stiffness with him, but Ariel is using his obliques now to help pull his knees up and get him into a posterior pelvic tilt while he tries to keep his head in a neutral posture. As you can see, I put some pads underneath Ariel's glutes and middle back to make sure that we can get that full flexion and a good stretch in that low back area. And the next stretch, which wouldn't necessarily be appropriate for those with knee instability, but if you didn't have any knee problems, it would be just fine. We can make sure that we can also get a little bit of a stretch in those lats, which can also promote a flat back, which we don't want, and get some deep inhalations and exhalations, which can help activate our obliques to help us get out of anterior pelvic tilt.